Hello, everybody. Thank you for tuning in to Chipcast. I hope you had a great 4th of July weekend and everybody stayed safe and had a happy holiday. Today, I just want to do something small by rewinding a time when I talked to Jonathan at Park and reinforcing to everybody the importance of keeping therapy and keeping active so that you can stay with us a little bit longer. So I am going to have Christian show us the interview from Park Rehab so that we can just have a little bit of a recap for that and make sure that we understand everything that we need to do to keep ourselves safe and healthy and in the independent living as long as possible. Jonathan, tell us a little about who you are. What makes you qualified to be, because you are the owner of Park.
Yeah, correct.
He owns it. He has no affiliation with Sage Healthcare, just so we know. Jonathan's the owner of Park.
Nope, I knocked on the door like a cold call, just like anybody else who's representing their company, and I'm fortunate enough to be sitting here as a partner. Yeah, I'm Jonathan Gasso. I'm the owner of Park. Home health, hospice, and rehab, and of course we have a lot of service lines that we offer. And I'm an occupational therapist by trade. And to keep this short, I would say the reason why I feel really qualified to be here, or the reason why I was vetted by their team as an appropriate partner, is because of my commitment to hospitality and customer service. This is your home. This is where you live. I consider myself an invited guest into your home. So I want to treat your home with respect, with dignity. I want to be kind. I want to make sure that all of the issues that you're having are being addressed and attended to. I want you to be able to trust us. That is one of the reasons why our healthcare company has found so much success, is that we don't just make it about healthcare, we make it about service. And so we're here to serve, and we have a lot of services to offer. And fortunate for me, all my services are covered by insurance, so there's no added cost for what we offer. So utilizing our service is never a bad thing. And that's one of the reasons why I'm grateful to be here to talk about what we have to offer.
Okay. So you are also partnered with Corewell Health, correct?
Correct. Park is also a preferred provider, a preferred vendor within the Corewell Health system as well. So that means that we periodically, we do have town hall meetings at the hospitals as well, where we go over our reports. We go over some important data that's very important to the hospital systems. And I know Laura touched on that when you talk about the hot politics and healthcare and the insurance companies. Rehospitalizations, that's one of our big keys. That's one of the big pushes in healthcare, is reducing your rehospitalization. So what we can do as a company to prevent you going to the hospital is one of the reasons why Corewell so proudly partners with Park.
So some of you are going to hear that and think, oh, what's the big deal if I need to go to the hospital? There's so many studies out there about what happens when people are going to the hospital. So my background is the SNF, so I'm going to go through real quick just to kind of explain one thing. So in skilled care, once you get into skilled care, because a lot of people leave the hospital and at this age they go to skilled care for a little bit of rehab. If you go back to the hospital within 30 days, they ding the hospital and they ding the provider, the skilled care provider. The reason is almost everything can be done and taken care of at the level that you're at skilled care. So the doctors and the nurses, they should be trained. If you notice that you're starting to feel a little off, they take your vital signs, they look at things. What happened to you? Do you have an infection? Do you need antibiotics? We can take those labs, we can send it off, we can get you your antibiotics, even the IV antibiotics. They're pushing for those things to happen because if you think about it, when you have to go to the hospital just to find out that you needed to drink a little more water and you have a UTI, so you need this little pill for the day, you had to pay for an ambulance to get you to and from. You had to pay for all the people to check you into the ER. You probably had to sit there for quite a long time. If you don't even get admitted, but you sit in observation, which usually happens for a couple days, then you're just paying for all of that. We also know that they don't get you up and out of the bed and moving around. You risk getting pressure ulcers, all kinds of things. So what happens is the goal is for everybody to kind of stay where they're at and get treated. When people leave skilled care or when they leave the hospital, now is the time for Jonathan's team to come in. So they come in and they do an eval. So that's one of the things that we're going to talk about here. So Jonathan, if I'm a resident and I'm at independent living and I go to the hospital, maybe I had a fall at home. And they say to me, oh, well, you're okay. You know, I thank God I didn't break anything, knock on wood. But they say, we're just going to send you back home. What can that person do? Can they request to see you?
Yeah, so this is where the part of your own healthcare journey where I say you become an advocate for yourself, because maybe the hospital, due to administrative burdens or people not, people calling off and not working, everyone's experiencing the challenges of hiring or having full-time staff. So
Qualified staff.
So for that reason, sometimes you will get discharged without the appropriate level of care. In order to receive home health therapy, you have to have just a few qualifying measures. One of them is a natural ability to find it difficult to leave the home. That doesn't mean you can't leave the home. I mean, I think for those that are independently driving, getting in and out of their cars, you may not be appropriate for home level therapy. But for many of you that are listening, if you know that you're using a walker or some sort of assisted device to walk around, or that getting in and out of the car does pose challenges, that qualifies you for home-based therapy. So I would say advocate for yourself. You have been paying into your Medicare benefit almost your entire adult life. Every paycheck you receive since you started working, you had some of that income go towards your Medicare. This is the service that you've been paying for your whole life. Why not utilize it? When we talk about providing healthcare or home therapy, physical and occupational therapy, even consider it preventative. You don't always have to wait for a hospitalization to happen. If you find that there's a setback, if you are dealing with sciatica, back pain, if you find that you're tripping over your feet, or you've had a recent fall that didn't even lead to an injury, but you had a recent fall, there's going to be clear signs that you're getting weaker. There's going to be clear signs that your gait or your ambulation is just not what it used to be. These are the times where I say, do your physical therapy. You are, many are blessed to say that they're retired. Mm-hmm. You've got the time to do it. And you still have the time to still enjoy leisure.
Yes, so you're entitled to this right.
Absolutely. It's covered 100% by your insurance. And our goal is to help keep you upright. Our goal is to help keep you from potential falls or hospitalizations. I say, why not take advantage of it?
So if you're leaving the hospital and you're not going to a skilled care facility, but you do feel like you've had a decline, and I talked about this in my town hall, this is one of the number one areas you see it, you're getting off the commode and you notice that it takes more than one push up. It takes you a couple tries to get up, or now you're pulling yourself up. Please not by the towel rack, because that's not on the wall that well. If you're pulling yourself up, if you're noticing those changes and then you fell and you went to the hospital, that's an example. Now you're discharging to come back home, because we know you did not ask to go to skilled therapy. Nobody ever asked for that. Now you can say, hey, I'm feeling a little weaker. You can ask that doctor or that nurse to write you a prescription for home health. And then you can say that you would like to use Park. You can use whoever you want. They can give you some options. We'll get to why I'm saying we partnered with Park. So you can say, I'd like to use Park. So when that resident says, I'd like to use Park and I'd like some therapy, and the nurse that's discharging says, oh, perfect, we didn't think about that. Sure, no problem. That nurse is going to get the prescription and they're going to send it to you directly. So that's all the resident had to do. Say, I'd like some therapy.
Yep.
And I'd like to use Park. And then they're set.
So any resident that wants to use the service when you're in a hospital system, we communicate with the hospitals through an electronic communication portal. So you let them know that Park is the agency you'd like to choose. They find our name in the portal. They send it to us electronically. Now we have all of your medical records. Now we can see what what was the reason you were hospitalized and what disciplines need to be added. So physical and occupational therapy. The one part of home health care, and we hope that this service is never needed. The reality is it's gonna be needed at some point for any of us, but also nursing services. If you do develop a pressure wound, or if you are on any new medications that require teaching, if you're on any sort of oral or IV antibiotic that requires a nurse to help manage, home health care does also have the ability to provide a nurse as well, also covered by your insurance. Also, speech therapy is another common thing. So anybody who may be developing some pocketing or some choking of food, they call that dysphagia. Speech therapy is also a very, very highly encouraged service to use if you find that you're having difficulty swallowing, or if you're choking on foods, or even just enunciating, or if you're having difficulty with slurred speech. Sometimes that could be a sign of a stroke. These are also covered services. I know physical therapy is probably the most popular by demand because that's what people know and need, but it's good to know that there's all these services, including nursing and speech therapy, that's also covered.
So let's just say you live here, you're living your life in your apartment doing what you need to do. Are you going to see your doctor for your annual evals? Maybe not. And you do notice a change in you. Don't delay on noticing that change and bringing it to a doctor's attention. So if you have difficulty getting out to see your doctor, you are allowed to still request to see Dr. Asbahi in the medical center. It's a good idea to go to the medical center if you haven't seen a doctor in a long period of time, because they can do labs and different things on you to kind of see what's going on. You don't have to give up your primary care physician that's out in the community that you haven't seen in a while. But the reason we still need you to see a doctor is because if you say, hey, Laura, I saw you were talking to this Jonathan guy from Park, and I need to see him, I think. Jonathan has to get a prescription from your doctor. So if you haven't been seen by your doctor in about a year, they're not going to write a prescription. They don't know what's going on with you. You are not considered an active patient. That's where we can get you in to see Dr. Asbahi in the medical clinic. I've introduced Dr. Asbahi and Jonathan to each other so that they can understand each other's services. And already in helping out at more of the assisted living side, Jonathan had somebody that needed to get a prescription updated. They needed certain things. Didn't work out in the end the way we wanted it to. But the point is, Jonathan got a hold of me. Hey, what can we do? I can get a hold of Dr. Asbahi. So when we're working together, when we have that connection and that relationship, and our goal is to get you all as healthy as possible, then we can do that. So if you go see Dr. Asbahi and you say, I'm just not feeling that well, I'm not as strong. Or like you said, I'm not feeling well. God forbid you get a new diagnosis, you need to check your blood pressure on a regular basis. You can say, I don't know how to do that. I need education on that. I've never checked my blood pressure before. Dr. Asbahi or your doctor can write a prescription for home health, and they can get a hold of Jonathan, and then Jonathan can send his nurse out who can work with you on making sure that you're doing those things correctly. So like he said, there's a ton of ways to do this. So one of the reasons that we partnered with Park is because we've identified as people were coming over to the independent living, and I talked to Jonathan about this when he very first came in to see us. This is a huge campus. It's probably taken you a minute to figure out where we're all at.
I still don't know. I still do not.
He can find me. So a lot of times what was happening is you discharge from wherever with, I'm not going to say who, X home health. They come to the campus, they get lost, they don't find you, or you're talking with your friends at Windows Cafe and you didn't realize the time, so you're not at your door and they come to see you. They have no investment in you, the person that's coming. They were assigned you. This is the eval that you go do today. Okay, they go do the eval. They go back to their boss. They say, eval not completed. They can say you denied it. They can say you weren't there. On average, and I can tell you this from my years of experience, nobody picks up the phone and says, hey, we came to your building to do an eval to get so-and-so on home health. What happened? How can we get them? They don't do that. Guess who's already done it? This person next to me, Jonathan. It makes sense for him to invest and make sure. So if his nurse, Michaela,
Yep.
comes to see you and you're not there, we've already set up. She's going to go talk to Joe. She's going to come to me. She's going to go to Mike Sala. She's going to go to Mike Lewinsky. She comes every Tuesday to our meetings. She's going to tell Jonathan, hey, I went to this apartment, nobody answered. We're trying to get a hold of them. If she doesn't have a plan, if she didn't get to talk to Joe or somebody else and she tells Jonathan that, Jonathan's going to call my phone. I guarantee you. Doesn't matter. We were texting on Saturday night not too long ago because we don't have lives. And he's going to say, Laura, what are we going to do to get this person some therapy? And then we're going to get a hold of you. That's why we're partnered with somebody that he did not send a salesperson in here. He came himself. When we told him what some of the concerns were that we had with other home health, just never showing up on time, never being honest about if they could find you or what was happening, he was like, I can handle that. And he's proven that he can handle that. He's proven that he's going to do that work to make sure that he's successful by making you successful. Not just by going out and signing up 50 buildings and not having anything to show for it, but by genuinely investing in the residents here and making them successful. So, Jonathan, how do you pick your team?
Thank you for everything that you said earlier. And to touch on that, that part is true. It was such a commitment for me that I really wanted to be here. And I recognize there's going to be challenges because of how large the campus is, how many different people are involved. But I knew that you all were being underserved because nobody took the time to make this work. And there is such a need and there's such a benefit to all the care that you can receive and how gratifying it would be for us to provide that care. It really has taken time to navigate the ins and outs, get to know people, understand personalities, and to make sure that we have the right fit. So when you talk about how do we select or choose, who's going to be a good fit, it's understanding every community that you're a part of. And Allegria is unique and it's very special here. And there are things that I've identified that are going to require certain levels of patience on our team side. So when it comes to identifying, so Michaela, for example, for our nurses, some of the identifying factors for me are customer service. You have to be somebody that's going to recognize that anybody who's in need of our care, if you take a different perspective as to what service we're providing, it's because something is maybe negatively going on in your life, right? Something is going on. There's an ailment, there's an illness, there's an injury. You're maybe not necessarily in the best mood. You're not in the best spot.
Nobody's happy when they don't feel good. They're scared.
So our service that's required of us is usually maybe at a downtime in your life. And so we're not just healthcare providers, we're customer service specialists, meaning we have to understand and recognize when we are there to provide care that we may not catch you in your best mood. We may slightly feel inconvenienced, right, for being there, but we're here to serve you. It's a leadership style, and I have to make sure that those that come to lead into your communities they lead as servants, meaning that we have to be patient, we have to have thick skin, we have to always smile, because we're here to serve you. So those are some of those identifying factors that I look for to make sure that I don't just send what you would consider the best. The best may not always have good personalities. The best might not always have good bedside manner. The best might not always have good people skills. You're individuals, Everything that's going on is very unique to yourself. So you're not cookie cutter. It's not just you're somebody who's has a UTI, or you're somebody who's had a stroke, or you're somebody who has diabetes. It's you are somebody who maybe has had a stroke, but also has 3 children, also is part of a crochet club. Like, you are an individual, and we need to treat you as an individual as opposed to a diagnosis. And that's something that I really value. And I look for that with people who work at Park. And I make sure that they're very comfortable with Laura, Lexi, whoever, having their phone number and being available at any hour of the day. Not to say that the goal is to contact us all the time at every hour, but there's going to be emergencies. And we need to be available as your healthcare providers to be there for you in emergencies. I want to touch a little bit about, the Dr. Asbahi commenter about people seeing their physicians. It may seem slightly inconvenient, but our goal, remember, is to keep you out of the hospital. And when you have a small incident such as a fall or heightened blood pressure, you don't want to go to the hospital, especially if you don't feel like you got an injury, but you want a healthcare professional to put their eyes on you. We cannot come out to see you unless the physician writes us a script to see you. So if you have not seen your physician recently, if I call your outside physician, they might tell me, oh, I have not seen them in 6 months. I cannot write you an order. And I'll say, but they had a fall. Well, they need to come see me first. Or Dr. Asbahi, if you've had a fall and you've seen Dr. Asbahi in the last couple of weeks, I can call Dr. Asbahi and say, the client that's in your system now as of 3 weeks ago, 4 weeks ago, they just had a fall. Can you write me an order? And he'll write me an order to come see you. And I can send out a physical therapist within a day. I can send out a nurse within a day. Those are some of the benefits to seeing your doctor more frequently. But if you have a hard time getting out of the house, utilizing the house doctor. Because we can communicate and get orders quickly, and we can get you seen quickly, and we may be able to prevent you having to go to the hospital.
Perfect. I know we don't have but much longer. We have a couple more minutes if I'm seeing this clock correctly. So I just want to make sure that everybody is aware, because there's a lot of questions that came to the town hall about Park and why I said we're partnering with them. So the big concerns that people have is, who is Park and who are they owned by? This is it. He has no ownership in Sage. So this is not something that comes from the corporate level. It can't come from a corporate level, really. I mean, it could, but at the end of the day, it's not, because we're utilizing the people that are around us and near us. Lexi and myself have a lot of experience with home health. We're very picky and jaded about a lot of home health because they just never follow through a lot of times. A lot of times you see a salesperson, and the salesperson says something, and that's the end of it. But the reason that we brought him in was to make sure that we have that closed system. So as we're wrapping up real quick, I just want to make sure, Jonathan, you also have hospice services available. I know we're going to do a talk soon about hospice services. One thing that people are not realizing is that hospice should not be the concept that you have a week left in your life. Do you also have palliative care services?
Correct, we do.
Okay, so I have 2 minutes left. I talked way too much to be able to get to palliative services, but we will do maybe another follow-up on just the hospice and palliative services. So Jonathan will come out to see us. So if you've gotten anything out of this show, you can call Joe, you can call Mike Sala, you can get a hold of Kim Murphy. You can ask them how you can get signed up for Park again if you need some assistance, and see your doctor. Go see your doctor so that when you have any declines, if you're feeling like you need that, you can get home health therapy. And thank you, Jonathan, for coming to hang out with me here on Chipcast. And again, just want to keep all of you happy and healthy. We're getting ready to go into summer. I'd like to see everybody outside doing some fun things, not cooped up and not stuck up in your rooms for as much as possible. So again, have a great day. Thank you so much. We'll see you in a couple weeks.
Thank you.